Botox onabotulinum toxin A is a medicine for adults with chronic migraine, which is migraine with 15 or more headache days a month, with each headache lasting 4 hours or more. Botox is not approved for adults with migraine who have 14 or fewer headache days a month.
My name is Sheila. I've been married 32 years. I used to work with my husband in our restaurant business, and I'm semi-retired now and spend time with my granddaughter. She's playful, funny, hysterical. It's a good life, but like anyone else, I've had a lot of challenges. And one of the greatest challenges I've had is my journey with chronic migraine. As a young woman, I had a lot of headaches, a lot of migraines, and I would separate myself out. I would be in a quiet room, total silence, total darkness. One of the most frustrating things was that I felt like a lot of the doctors didn't understand migraine, didn't understand the headaches. I had one doctor, when I was going through this revolving door of doctors, who had actually told me he thought my pain was in my head, implying that I was making it up or that he thought I was crazy, but the pain was incredibly intense and he just didn't understand. By this time, I was having more days with headaches than without them. Eventually, I found out a headache specialist, and I think he listened as much to what I didn't say as what I did say. My doctor told me I had a condition called chronic migraine. He assured me that we would get through this together. There were always options, and that was one thing in the partnership that he did, was he always offered me options. He's the one that recommended Botox. I'd never realized that it was used for chronic migraine. Since starting Botox, I have significantly fewer headache days. Once I started my Botox treatments, my doctor was recommending coming in every 12 weeks. And I did that for a while, and then I was doing so well that I tried to space out my Botox injections a little longer. And I soon realized that I couldn't do that I was having more headache days, and I realized that I did indeed need to go every 12 weeks. My advice to someone who suffers from chronic migraine is find a doctor sooner than later. I wished I'd have not waited to find a good headache specialist. As far as I'm concerned, Botox has been a smart investment in managing my chronic migraine. If you're not spending all your energy praying that another migraine doesn't come, that's a good thing.
Botox is a prescription medicine that is injected to prevent headaches in adults with chronic migraine who have 15 or more days each month, with headache lasting 4 or more hours each day in people 18 years or older. It is not known whether Botox is safe or effective to prevent headaches in patients with migraine who have 14 or fewer headache days each month, episodic migraine. Important safety information. Botox may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks, after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. There has not been a confirmed serious case of spread of toxin effect away from the injection site when Botox has been used at the recommended dose to treat chronic migraine. Botox may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not take Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A, have a skin infection at the planned injection site. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you experience symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby. Are breastfeeding or plan to. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myoblock, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received, have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information, including boxed warning and medication guide.
Thanks, doctor, for recommending Botox. I'm so thankful to have fewer headache days.